In a critical moment, a person suddenly collapses before you, unresponsive and not breathing normally. This alarming event signifies cardiac arrest, where the heart fails to pump blood effectively, leading to a rapid loss of oxygen to the brain. Acting swiftly is essential. First, assess the scene to ensure your safety. Make sure no danger surrounds you. Approaching the individual, tap their shoulders and call out, "Are you okay?" If there is no response, immediately contact emergency services for assistance and ask someone nearby to retrieve an AED, if available. Next, check for breathing. If the person exhibits no normal breathing or is merely gasping, it's time to initiate CPR without hesitation. Position the person flat on their back on a hard surface, ensuring they are stable. The next steps are crucial. Place the heel of one hand in the center of their chest, then place your other hand on top, interlocking your fingers. Maintain straight arms and keep your shoulders directly above your hands. Begin chest compressions, pushing hard and fast at a rate of 100 to 120 compressions per minute, allowing the chest to rise completely after each thrust. If you have CPR training, provide 30 compressions followed by 2 rescue breaths. However, if you're untrained, focus solely on hands-only CPR without pausing. Continue this life-saving action until professional help arrives, an AED is utilized, or the individual resumes normal breathing. Should the person regain consciousness, carefully place them in the recovery position and remain by their side until assistance arrives. Remember, you don't need to be a medical professional to save a life. What matters most is your prompt response. Every second counts, and each compression you deliver increases the chance of survival. Take action, and you may be the difference between life and death.